Okay guys, now we're going to demonstrate hand washing. What's important to note is that you have a minimum of 20 seconds and a maximum of 3 minutes. You have to finish this procedure in that window. Also, when you're washing your hands, you want to do so over the sink and don't allow your scrubs to touch the porcelain or your hands to touch the sink. Okay, for this procedure, most towel dispensers at the test centers fall out or automatically. This I have to do manually, so I'm going to use a napkin as a barrier each time. So let's go ahead and begin. Okay, I'm going to pull my napkin to turn on my water. I'm going to adjust the water to a nice warm temperature. Okay, I'm pretty happy with that. Now I'm going to go ahead and apply some water to my hands. And you can see I'm not allowing my scrubs to touch. And let's apply some soap. Now I'm going to get a nice lather on my hands. If you don't apply enough water, then the soap will get real sticky. And as you can see, I'm going to get it 2 to 4 inches above my wrist. Alright, I'm going to start by interlacing my fingers. And I'm going to clean each finger individually. And once I'm done with that, I'm going to clean each cuticle individually, which is the top of the nail, okay, where the instructor can see clearly that I'm doing that. In fact, it helps to verbalize what you're doing so the instructor knows beyond the shadow of a doubt that you know what you're doing. Now I'm going to clean my nails by scrubbing my nails in the palm of my hand, and it very effectively removes bacteria from under the nails. Okay. Now I'm going to lather up and get a couple inches above my wrist again. And now I'm going to go ahead and start the rinsing procedure. Now, very important that you don't recontaminate your hands while rinsing by touching the sink. Okay. When you get all the soap off, let your hands drain for a couple minutes. You want to be sure not to shake your hands and throw water all over the room. Alright, I'm going to go ahead. The first thing I'm going to do is turn my water off. Now let's dry my hands. So I'm going to stay over the sink. I'm going to dry from the tips of my finger to my wrist, or cleanest to dirtiest. You don't want to drag any bacteria back down from your forearms to your clean hands. So let's go ahead and start down low at the fingers. And once I go up, I'm not going to use this anymore. Okay? Again, I'm going to start down at the bottom where my thumb is. Once I go up, I'm not going to use it anymore. Let's do one more pass to make sure my hands dry, because if I don't, it will be very difficult to put my glove on. Okay, let's get this hand nice and dry. Maybe one more. Alright, that concludes washing hands. The good thing about this procedure is you know that it's one of your 5 that you're going to be tested on, along with indirect care, how you communicate with a patient or a resident. So you should have this down pat. It's very easy to do properly, but it's easy to mess up if you underestimate it. So practice, practice, practice.